Hello, my name is Charmaine Shepherd. I'm a fully certified functional medicine practitioner. I've been in practice in Edinburgh for 18 years. One thing that makes me really sad is looking at the statistics around heart health. 1 in 3 people in the UK will die from a heart condition, but many more will go on to live with kind of the crippling effects of having had a heart attack or a stroke. And the really sad thing is that most of these conditions are really preventable. The heart and the circulatory system is very amenable to lifestyle change and to some natural treatments as well. So let me tell you a story. A few years ago, one of my patients who I'd been seeing for quite a while comes in and says, I'm really worried about heart health. I don't have any symptoms. I'm in my 50s. I feel good, but I have a very long family history of heart disease. So we decided to do a really extensive lab panel and all the other things that go around that as well, body composition, heart rate variability. And we do see that there is some risk for her. She then says, well, you know what? I'm worried about my sister. Obviously the same genetics. And so she brings along her sister, and we do the same diagnostics for her. We find that her sister also has a risk, but actually the underlying driving factors are quite different for the two of them. While one of them has got strong metabolic drivers, so in other words, her blood sugar and insulin levels were quite high, which we know is a higher risk for heart disease. The other had more higher levels of inflammation. Both of them had higher cholesterol. So the approach is very different for the two of them. And they go off and they do all the bits that we've decided they need to do. And then 3 months later, we test them again and we can see quite significant differences for both of them. But both of them had quite a personalized and different approach. The exciting thing is seeing how it works and how well it works when you do really thorough testing, and you're very, very clear about where the person needs to focus and intervene. However, that can be really expensive. So from a functional medicine point of view, doing very personalized testing can often end up being really, really pricey if you then also factor in the consultations. So we've decided to put together really extensive 6 weeks program, a group program, whereby people still have very extensive lab values. We do carotid ultrasounds, we look at heart rate variability. So we really look at all the factors that we know could be driving a heart or cardiovascular process. And then we work out for each person what they need to do individually. And then we take them on the 6 weeks journey of looking at all the things that can impact, including diet and nutrition, stress, exercise, so many factors that people can make a difference to. We look at also how people can implement these changes, because it's one thing knowing what you need to do. It's quite another thing how to, on a day-to-day basis, bring these changes in for health. And I present this program together with my colleagues, Jackie, who's a nutritional therapist, Joanna, who's a health coach, and my colleague Jean, who's a medical herbalist. We've come together to create a really, really fantastic program. So if you'd like to find out more, please get in touch to find out when our next program is running. Thank you.